In this podcast episode, Peter Attia engages in a discussion with Dr. Saum Sutaria, a prominent figure in the healthcare industry. They explore the intricate landscape of the U.S. healthcare system, focusing on insurance, drug pricing, and potential reforms. Dr. Sutaria begins by discussing the historical context of insurance in healthcare, emphasizing that it was originally designed to protect against random, catastrophic events. In the past, insurance made sense for unpredictable health crises like heart attacks or accidents. However, as chronic illnesses have become more prevalent, the traditional model of insurance has struggled to adapt. Today, many individuals rely on insurance for routine care, such as managing diabetes or receiving preventive checkups, which blurs the lines of what insurance was intended to cover. This shift has transformed insurance into more of a discount card rather than a safety net for catastrophic events. The implications of this change are profound, as it has led to a system where individuals are less sensitive to the costs of their healthcare, ultimately driving up expenditures. Dr. Sutaria highlights that the current healthcare system is not just about insurance, it's about how we manage chronic diseases and the associated costs. The conversation shifts to the staggering scale of U.S. healthcare spending, which currently accounts for nearly 20% of the GDP. Dr. Sutaria notes that this translates to approximately $4 trillion annually, with a significant portion coming from government sources. He explains that the financing of healthcare in the U.S. is complex, involving consumers, employers, and government contributions. This multifaceted funding structure complicates the understanding of where money flows and how it impacts overall healthcare costs. Dr. Sutaria emphasizes that the sheer size of healthcare spending in the U.S. is not just a healthcare issue, it's an economic one. As healthcare expenditures continue to rise, they inevitably affect other sectors of the economy. The challenge lies in balancing the need for quality care with the economic realities of funding such a vast system. The discussion underscores the importance of understanding the financial dynamics at play in order to address the challenges facing the healthcare system. The role of government in healthcare financing is another critical topic addressed in the podcast. Dr. Sutaria explains that government spending on healthcare has increased significantly over the years, particularly with programs like Medicare and Medicaid. These programs were established to provide coverage for vulnerable populations, but they have also contributed to the rising costs of healthcare. Dr. Sutaria argues that while government involvement has expanded access to care, it has also led to inefficiencies and challenges in managing costs. The discussion highlights the need for a reevaluation of how government programs are structured and funded, as well as the potential for reforms that could improve efficiency without sacrificing access to care. The conversation suggests that a more strategic approach to government involvement could help mitigate some of the financial pressures on the healthcare system. One of the defining features of the U.S. healthcare system is the prevalence of employer-sponsored insurance. Dr. Sutaria explains that this model is unique to the United States and has significant implications for how individuals access care. He notes that many people receive their insurance through their employers, which creates a complex relationship between employment and healthcare coverage. This system has both advantages and disadvantages. On one hand, it provides a level of coverage that many individuals might not otherwise afford. On the other hand, it ties healthcare access to employment, which can create challenges for those who are unemployed or underemployed. Dr. Sutaria emphasizes the need for a more flexible approach to insurance that allows individuals to maintain coverage regardless of their employment status, thereby reducing the barriers to accessing care. Chronic illness is a significant driver of healthcare costs in the U.S., and Dr. Sutaria delves into the implications of this trend. He highlights that conditions such as obesity, diabetes, and heart disease are becoming increasingly common, leading to higher expenditures on healthcare services. The prevalence of multiple chronic illnesses complicates the management of care and drives up costs for both individuals and the healthcare system as a whole. The discussion underscores the importance of addressing the root causes of chronic illness, including lifestyle factors and access to preventive care. Dr. Sutaria argues that a proactive approach to managing chronic diseases could help reduce overall healthcare costs and improve health outcomes. By focusing on prevention and early intervention, the healthcare system can shift from a reactive model to one that prioritizes long-term health and well-being. Drug pricing is a contentious issue in the U.S. healthcare system, and Dr. Sutaria provides valuable insights into the complexities surrounding this topic. He explains that the U.S. spends significantly more on pharmaceuticals than other developed nations, often without corresponding improvements in health outcomes. The high cost of drugs is a major contributor to overall healthcare expenditures, and it raises questions about the sustainability of the current pricing model. Dr. Sutaria discusses the role of pharmacy benefit managers, PBMs, in the drug pricing landscape. He explains that PBMs act as intermediaries between pharmaceutical companies, insurers, and pharmacies, and their involvement has created a complex web of pricing and reimbursement. The discussion highlights the need for greater transparency in drug pricing and the potential for reforms that could help lower costs while maintaining access to essential medications. The role of PBMs in the healthcare system is a critical topic, and Dr. Sutaria explores the implications of their involvement in drug pricing. He notes that while PBMs were initially created to help manage the complexities of the pharmaceutical market, their practices have come under scrutiny for contributing to rising drug costs. The discussion raises important questions about the effectiveness of PBMs and whether their current model is sustainable. Dr. Sutaria emphasizes the need for reform in the PBM space, suggesting that greater transparency and accountability could help address some of the challenges associated with drug pricing. He argues that a reevaluation of the PBM model could lead to more efficient and cost-effective solutions for managing pharmaceuticals in the healthcare system. The conversation underscores the importance of finding a balance between managing costs and ensuring access to necessary medications. Value-based care is a concept that has gained traction in recent years, and Dr. Sutaria discusses its potential to transform the healthcare landscape. He explains that value-based care focuses on improving patient outcomes while controlling costs, shifting the emphasis away from fee-for-service models. This approach aims to incentivize providers to deliver high-quality care, rather than simply increasing the volume of services provided. The discussion highlights the challenges associated with implementing value-based care, particularly in a system that has historically prioritized volume over value. Dr. Sutaria notes that while there have been efforts to promote value-based models, many have struggled to achieve meaningful results. He emphasizes the need for continued innovation and collaboration among stakeholders to develop effective value-based care solutions that can improve patient outcomes and reduce costs. Technology plays a crucial role in shaping the future of healthcare, and Dr. Sutaria explores its potential to drive improvements in efficiency and quality. He discusses the impact of electronic medical records, EMRs, and the opportunities presented by artificial intelligence, AI, in streamlining administrative processes and enhancing clinical decision-making. While the implementation of EMRs has been costly, Dr. Sutaria believes that they provide a foundation for leveraging technology to improve patient care. The conversation also touches on the potential of AI to revolutionize healthcare delivery. Dr. Sutaria highlights the promise of AI in analyzing vast amounts of data to identify trends, improve diagnostics, and enhance treatment plans. He acknowledges that while the technology is still in its early stages, its potential to transform healthcare is significant. The discussion emphasizes the importance of embracing technological advancements to address the challenges facing the healthcare system. Dr. Sutaria argues that the U.S. lacks a cohesive national health objective, which hampers efforts to address the challenges facing the healthcare system. He emphasizes the importance of establishing clear goals for improving health outcomes and reducing costs. Without a unified vision, efforts to reform the healthcare system may lack direction and effectiveness. The discussion highlights the need for collaboration among stakeholders, including government, healthcare providers, and the private sector, to develop a comprehensive national health strategy. Dr. Sutaria believes that setting clear objectives can help guide policy decisions and resource allocation, ultimately leading to better health outcomes for the population. The conversation underscores the importance of a coordinated approach to addressing the complex issues within the healthcare system. Aging is a significant factor influencing healthcare costs, and Dr. Sutaria discusses its implications for the future of the healthcare system. He notes that as the population ages, the demand for healthcare services will increase, placing additional strain on the system. The conversation highlights the need for proactive measures to address the challenges associated with an aging population. Dr. Sutaria emphasizes the importance of focusing on preventive care and managing chronic conditions to mitigate the impact of aging on healthcare costs. By prioritizing health promotion and disease prevention, the healthcare system can reduce the burden of illness and improve overall health outcomes. The discussion underscores the need for a comprehensive approach to aging that considers both the medical and social aspects of care. Public health plays a critical role in addressing the rising prevalence of chronic illness, and Dr. Sutaria discusses the challenges associated with this issue. He notes that while public health initiatives have been successful in reducing infectious diseases, they have struggled to make a significant impact on chronic conditions such as obesity and diabetes. The conversation highlights the need for a renewed focus on public health strategies that address the root causes of chronic illness. Dr. Sutaria argues that effective public health interventions must be evidence-based and tailored to the specific needs of communities. He emphasizes the importance of collaboration between healthcare providers, public health officials, and community organizations to develop comprehensive strategies for promoting health and preventing disease. The discussion underscores the need for a multifaceted approach to public health that addresses the social determinants of health and fosters healthier behaviors. As the conversation draws to a close, Dr. Sutaria reflects on the future of healthcare in the U.S. He emphasizes the importance of innovation, collaboration, and a commitment to improving health outcomes. While the challenges facing the healthcare system are significant, he believes that there is potential for positive change through strategic reforms and a focus on value-based care. Dr. Sutaria concludes by reiterating the need for a national health objective that prioritizes the well-being of the population. He encourages listeners to engage in discussions about healthcare reform and to advocate for policies that promote access, quality, and affordability.